quantitative research, what is it? Tell me what it is. It deals with numbers, right? So it's research that deals with numbers. All right. There's usually a sampling plan. It's specified in advance. And the reason you want to specify it in advance is so that it's very clear up front to your peer researchers and to your team exactly how you're going to get your sample. You also have to clarify your sampling plan with the IRB. Sampling plan will determine, you'll determine how you're going to get your sample, what size of sample you need, the types of subjects or participants that you use. I use the word subjects and participants usually interchangeably because I'm a qualitative person, and so in qualitative research we use participants more than subjects. Qualitative, excuse me, quantitative is subjects, okay? So if you hear me say the word participants when we're talking about quantitative research, or I said to someone earlier today, number research, then we're using the word subjects, okay? But all subjects are then recruited from a larger population, and the population of interest is specified at the beginning. And you determine that by determining who the findings are going to apply to. So you want to then understand that based on your research questions, which you develop first. Right. Good sampling is critical to how confident you can be in how accurate your findings are. The smaller the sample size, the less reliability you're going to have in those findings. Larger sample sizes provide you with higher reliability. We're going to talk about reliability and validity in the next couple of weeks, but we're not going to get into that today. Key terms I want you to know, and something that I wanted to point out to you is if I have something in a different color, or if it's bolded, or italicized, I want you to really pay attention to those key words, okay? You will see those again. So the word population is something that you need to understand. And it's the entire set of elements or cases. Your book uses the word elements, but it can be the same thing as subjects or cases that a researcher is interested in. That's a population. The sample is then a subset of that population, and it represents the entire population of whom you're interested in. And I just explained the elements, which is the basic population unit, the cases, the people, the subjects, the labs that you are interested in and that the information is collected from. So the entire set of elements, cases in which a researcher is interested is called what? Population. Right. Very good. I think you guys have that slide, the first one, right? The fill in the blank?
Yes.
So here's a red word and a green word. A sample is a select group of elements or individuals that is representative of all the subjects or elements. The basic sampling concepts in quantitative studies is the entire set of cases or an aggregate set of the cases in which the researcher is interested. And when you're sampling, you're selecting a portion of the population or a sample of the population that's a subset of that. And that sample is supposed to be representative of the whole group. And so this is a demographic that shows you the population is all nurses. We'll say we're going to do a study. Population would be all nurses. My target population may be ICU nurses. The sample are those that are randomly selected, or that I stratify random selected, or maybe it was a convenience sample, okay? The sample are the people who are actually in this study. Does that make sense? Mm-hmm. Does that example help you? And this is just an explanation of that. Population are all the possible subjects, which are maybe all RNs for my study. Target population are those ICU nurses that meet the study. It could be anybody. It could be, the population could be all patients that have wounds, and then the target population, well, the population could be all patients, and then the target population could be all patients who have a wound on their left foot. And then the accessible population is who I have access to, because I live in Greensboro. So I don't have access to patients who live in Washington State. They're not part of the accessible population. The accessible population is the wound care clinic near where I live, in this area or in this state. That's the accessible population. And then the sample are randomly selected from that accessible population. The aim of the population, the aim of sampling is to produce a miniature copy of the population. We want to get something that looks just like the population. Does that make sense? Mm-hmm. You want it to be as closely represented as possible, and you can see here in this red box that those 4 people look exactly like all the rest. They are representative of all the other people in the population. And so when you're talking about sampling, some of the key terms that you need to know are representativeness, inclusion criteria, exclusion criteria, sampling error, and sampling bias. So representativeness, we just talked about that. It means exactly what it sounds like. It means the sample needs to be representative of the population. You do this so that you can generalize the findings that you get from studying the sample back to the population. And the bigger the sample size, the more generalizable those findings are to the larger population. You want to make sure when you're selecting your sample that those cases or elements have the same characteristics of the people in the population. That's representativeness. All right. Which of these samples is most representative of the big one here? Sample A or sample B? Tell me why. It does have the little black dots. It has the black dots. Does sample A have black dots? No. And so may have been drawn from that same bucket, but it does not represent the fact that there is some diversity in the bucket. And so in your sample, you need to have the same diversity represented. Does that help explain representativeness a little? Okay. The other thing I want to go back and point out is that, what about the sample size? Does this seem pretty representative of this number of people in this population? No, sample B has a better representation. It's a larger sample size. All right, inclusion criteria. What does that mean? Inclusion criteria means that those are criteria that I am going to require every person who is in my sample to have. So maybe I'm studying, I'm trying to think of something off the top of my head. It needs to be something that is similar to the population. So that may be age or demographics. Maybe they're a similar diagnosis. Maybe I'm studying all women who have an elevated troponin level. And I wouldn't want to include someone in my sample that has an elevated sodium level when I'm not studying sodium. That may happen, but they also need to have elevated troponin levels. That means they have inclusion criteria. My inclusion criteria for my research study was that they were all nurses who had been in practice since 2003. The reason I chose that date was because that's when HIPAA was enacted, and that's what my study was about. And so you start with your research question, what's it about? And then what kind of people, what kind of characteristics need to be included in the study so that you are representing the population that you're interested in, and that you're not going to get what extraneous variables that will impact your findings. Are some of these terms starting to come into play in how you're putting them together? You remember the term extraneous variables? Mm-hmm. Yeah. So you want to make sure that your subjects meet your inclusion criteria. Exclusion criteria are things that you want to make sure that your subjects do not possess. So if you are, exclusion criteria for me, for my research study was that they had to be an ICU nurse. So floor nurses were excluded from participating in my study. Okay? Exclusion criteria means things that you are not interested in your participants or subjects to have. Sampling error is a fluctuation of a value of statistics from one sample to another that's drawn from the sample. So it's when the subjects in the study do not adequately represent the population. So do you remember the little bucket a few minutes ago? Sample A, the little one? That would have been an example of sampling error. There was an error made when they performed or when they pulled the sample. The sample is never exactly the same as the population. But your goal is to minimize any errors that are related to that. Errors decrease whenever sample size increases.
I guess how much of a distinction is there between sampling error and sampling bias?
We're going to get to that. We're going to get to that. So in order to minimize sampling error, what can I do? Yell it out.
Larger sample size.
A larger sample size, right. Very good. So if you see that again, would you be able to answer it correctly?
Mm-hmm.
Yeah. All right. When you have a sampling error, what happens to the validity or the reliability of the findings in your study? It goes down. Now, the young lady in the front asked about sampling bias, which I told you we'd get to. This occurs when there is an over or an underrepresentation of the characteristics of the population, and it does pose a threat to the validity of the study. So this happens when there are too many black dots because it's overrepresentative, right? Or when there's underrepresentation. So little bucket A, remember from the slide back a few slides back? There's also sampling bias in that. So when subjects are assigned to treatment groups using a random assignment, selection bias is reduced. So if I pull all of those beads or those dots that were in that bucket out randomly, then the opportunity for me to have sampling bias is reduced. And there are all sorts of things that can cause sampling bias. One of those is the researcher themselves, especially if there's no randomization. So here are different types of sampling, and your book does a really good job at spelling these out, what types there are, how they're done. There's two main types, probability and non-probability. Non-probability are things like quota, volunteer, convenience, snowballing, purposive. And probability are things that have to do with randomization. Simple randomization, stratified randomization, clustering, systematic randomization. And we'll get into these a little more. All right, true or false? In probability sampling, every member of the available population has an equal chance of being selected for the sample. True. What's it also called? Randomization or random sampling. Very good. Some key points to remember about randomization. This ensures that each participant has an equal chance of being placed in any group. Do they have an equal chance of being placed in any group? Yes. This helps ensure that any differences between or within the groups is controlled for. All right? You want there to be no systematic, or you don't want there to be intentional placement of people in groups. If I'm going to randomly put you in groups, you're all going to be randomly put in groups. I'm not going to say, well, I'm going to randomize this group of people, but not those. All right. This helps you to increase your confidence or the validity of your findings. It increases the confidence that the cause or the effect, which is the intervention, actually caused what happened, the findings, or the impact on the outcome, which is called what? The dependent variables. Very good. So the goal for randomization is to make sure that your intervention or independent variable is what caused the findings, the outcomes, or the dependent variable. All right, probability sampling. Each member of the population has what kind of chance of being selected? Equal. How many times has Dr. Newman said that? At least 4. So I highly recommend that you highlight it, underline it, star it, you'll see it again. There are many ways to do this. Simple random sampling is where you just pull put every participant or subject on a random table and you just have random selection off of that table. Usually Excel is a really good program to do this. You have systematic sampling where I take every, and I decide ahead of time before I'm doing my study, that I'll take every fourth case that comes to be presented to me. So if I'm choosing all the students, if I have my population is all students at UNCG, and my target population is nursing students, then I'm going to take every fourth nursing student who comes into the program and ask them to be my subject. Does that make sense? Okay. Stratified random sampling is dividing students or dividing subjects or dividing patients or nurses into groups, and then you select your sample from each group. And cluster sampling is groups within groups within groups. Simple random sampling. Drawing names out of a hat. Using a table of random numbers. A computer program to generate random numbers, and what I mentioned was Excel. Or a coin toss, right? So when I toss a coin up in the air, unless I'm having a, what's it called, a single-sided coin where they have heads on both sides. There's a specific name for that. Anyway, unless I'm cheating and I have heads on both sides, then it's random. I have no control over where that coin's going to land. So a coin toss is a good example of simple random sampling. Everybody hear that one? Yeah. Systematic random sampling. It's and we've gone over this, but it's where I'm going to take every third person or every fourth person to be a subject in the study. And you can see where this is every third person is selected. So they started here at 2, and then they chose number 5, and then they chose on. And so you can see where it's every third person. It doesn't have to be every third. It's up to the researcher. They can choose any number they want. They can say every other. They could say every fifth. They could say every eighth, every 10th. So the researcher has to determine that as part of what at the beginning of the study? Sampling plan, that's right. You have to outline these things in your sampling plan at the beginning of the study, at the beginning of, before you even start. You'll submit that to the IRB. Other types of random sampling are cluster, small subjects of the population. Stratified random is selecting subjects from a divided population. Not spending a lot of time on that because I don't really want you to get into that too much, but I wanted you to know that there are, those are certainly possible. Non-probability sampling is the most common. It's convenience sampling. The reason it's the most common is because it's convenient and it's not expensive. I don't have to do a whole lot of fancy footwork and trying to figure out every 9th, 10th, or 4th or 5th case. I don't have to worry about making cluster groups. I don't have to worry about making different levels and then selecting from that. Quota sampling is similar to stratified sampling, but it's not random. Stratified sampling is the one we sort of went through quickly. I'll go back for just a minute. Stratified is subjects are placed into one strata, such as gender, and then the subjects are randomly selected from that strata. So I may have all of the females in this group and all of the males in this group, and then I'm going to randomly select from this group and randomly select from that group. That's stratified random. Okay. Compare that to quota sampling, which is similar to stratified but not random. You can also have purposive sampling, which is intentionally selecting participants based on certain characteristics or experiences or attributes. So maybe I'm only going to interview, or maybe I'm only going to study nurses who work on a telemetry floor who have had a code blue experience in the last 6 months. That's purposive sampling. I'm sampling based on certain characteristics. And when do I identify that I'm going to do that? In the sampling plan. And when do I identify a sampling plan?
The beginning.
At the beginning. Right. Now, there's a high probability of bias when you do that type of sampling. You also can ask for volunteers. And so how many of you have volunteered to be in a research study before? The researcher did not come to you and say, will you be in my study? The researcher said, hey, I have this study, are you interested in being in it? Or they posted a flyer on the board. I noticed out here there's a couple of flyers posted in the hallway. That's volunteering for a study. Snowballing is a sampling method where you get someone who volunteers, but then you may say, do you know somebody else who would be interested in this study? And then you go to that person, and they may say yes or no, but then you ask that person, do you know anybody else who might be interested in that study? So you can see where you start out with one small subject or participant, and then it gets bigger and bigger and bigger like a snowball, right? That's why it's called snowballing, because it resembles just that. You start out with one, and ask that person for a referral, and get another one, and then you get another one, and another one, and another, until you have a big enough sample to answer the question that you're interested in. Now, how do I know what size sample is big enough? Well, in quantitative samples, we have something that's called a power analysis, and this is just information for you to know. Don't focus a whole lot on this. It's how you predict how large of a sample you need. There's all sorts of statistical formulas that exist, and all sorts of statistical software that will help you predict how big your sample needs to be in quantitative studies. And we're not going to talk about that at all, but I just wanted you to know that in quantitative studies, there is a statistical formula that tells you how big your sample needs to be in order to achieve the validity of the results that you want. In qualitative samples, this is important for you to know. In qualitative samples, you stop sampling or stop doing your interviews or passing out your surveys. You stop collecting data when you get to saturation. Okay? Saturation is the point where you're not getting any new information. You're hearing the same things over and over again in the surveys where the people wrote out their responses to your questions. You're reading the same things over and over again. And so you're getting saturated like a sponge with the same information. Does that make sense? Mm-hmm. All right. So it's when the point at which no new information or the same information is being generated. Samples have characteristics, heterogeneity and homogeneity, or homogeneity. What do you think heterogeneity is? How diverse the subjects are within their group and in relation to the population. What about homogeneity? How similar the subjects are within the group. It's just that simple. Attrition. Dropout. That's right. Attrition is the same as dropout. What can cause attrition or dropout? Death. Certainly one of the worst ones, yes. What else can cause it?
Moving away.
Moving away. What else?
It's a long study.
Say it again.
If it's a long study.
If it's a long study, you might lose people who aren't interested. What did you say up there?
They decide they don't want to do it anymore.
They decide they don't want to do it anymore. They give up, or maybe they can't afford to drive to the hospital where you're collecting the blood samples or where you're collecting the data. Right? Anything else? It could be anything. People can drop out of studies for any reason that they want.
If they feel like they're having to do too much for study, like in a
Exactly. If you're sampling, if your research protocol, your intervention requires a lot of work on the part of the participant, they may drop out because it's too much work. They are confused by asking them what to do. Maybe they are uncomfortable with the types of questions you're asking. If a nurse joined your study because she thought she was going to be asked about patient satisfaction and patient safety, and you start asking her questions about medication errors and has she ever made a medication error or has she ever breached confidentiality, do you think she's going to stay in your study? Maybe, maybe not, because it's not what she signed up for or what she thought she signed up for, right? It's important to clarify that kind of stuff whenever you're giving them the information for participating in the study. All right, so what happens if you have too small of a sample size and you have a large attrition rate? I don't have enough information, and so the validity and the reliability of my study goes down. Exactly. This is why it's really important for you to, if you're doing a quantitative study, to make sure that that you perform that statistical analysis to find out how big of a study do you need to account for attrition. Because it will happen. You will lose people because they get sick or they move away or they get tired of the research protocol. It's also important to pay attention to how you recruit participants. Are you going to post flyers? Are you going to tell the students in the class, you have to be part of my research study? Are you going to go to the Walmart and stand in front of the Walmart and say, I have this really great study about patients who are, or people who are shopping at Walmart in their pajamas? So you may, it happens. It may, you have to get your sample where they are, but you also have to determine how are you going to recruit that sample. If I want to study people who shop at Walmart in their pajamas, I don't want to go to the Target and ask questions, right? I don't want to go to the McDonald's and ask questions. I want to make sure I'm where I'm going to get a sample that's representative of the population that I'm after. All right. Questions about that? Lots of questions.
Are you going to post these flyers with the notes?
No, I posted all the slides.
They don't have the notes. I tried to type as best I could, but I missed a couple of the
I
slides.
didn't realize it was showing my speaker notes.
Mm-hmm.
No, I hadn't intended on doing that, but I can since you've asked. I typically don't do that, though, no.
Is consecutive sampling and inclusion criteria the same thing?
No. So what is inclusion criteria?
What you're including.
Characteristics that each element has to possess.
Right, characteristics that each subject has to possess. Consecutive sampling is where you're going to get it's just that, consecutive sampling. It doesn't have to do with the inclusion or exclusion criteria.
Oh, I put proposed sampling that you intentionally select participants based on certain characteristics.
So you said consecutive sampling. You meant purposive sampling. Okay.
Oh, I was writing your notes, and
Sorry.
they were right under each other.
Okay, so purposive sampling is where you select people based on certain characteristics. They have to meet your inclusion criteria, yes. But purposive sampling is a sampling method. Inclusion criteria and exclusion criteria describes the sample. Yes. So it's basically like saying, when you go for a ride at Disney, you can't be pregnant, right? That's an exclusion criteria. You have to be 3'5" tall. That's an inclusion criteria. So in order to ride, in order to participate in the research study, you have to meet certain things. And you can't be certain things. So you can't have hypertension and have had a heart attack yesterday to ride the drop zone. Drop zone, is that right? Tower of Terror. Tower of Terror. You can't have had a heart attack last week and ride Tower of Terror today, right? You have to be a certain height. You can't be a certain weight. So those are examples of inclusion and exclusion criteria. Did that help? Yes. Okay. What other questions? Anything else?
So now I don't know what consecutive sampling is. I'm sorry.
I'm going to tell you not to worry about that.
Okay, great.
Anything else? All right. Let's talk about something else. I'm going to put